Take a live look at the White House now. President Biden out with a new proposal that could make popular weight loss drugs covered by Medicare or Medicaid. The move immediately setting the stage for a showdown between the powerful pharmaceutical industry and Robert F. Kennedy Jr., President-elect Trump's pick to lead the Department of Health and Human Services. While the rule would give millions of Americans access to weekly injectables used to help people shed pounds, it would cost U.S. taxpayers a whopping $35 billion over the next decade. So let's bring in Julie Rovner, Chief Washington Correspondent for KFF Health News and host of the podcast, What the Health, which is my favorite name for a podcast. Julie, the current HHS Secretary, Javier Becerra, says today is a good day for anyone who suffers from obesity. What do you make of this?
Well, it's a little bit early. This is the very beginning of a process that won't be finalized until at the earliest the middle of next year. Obviously, the comment period for this rule doesn't end until after the Trump administration begins. So this is, as you mentioned, something that could easily be reversed by the incoming administration. But it is a significant step for HHS to come to the conclusion that the ban on Medicare paying for weight loss drugs does not necessarily apply to these drugs for people with obesity. Now, this would not be available to everyone who is overweight, but it could be available if this goes through to people whose BMI is high enough to make them clinically obese.
Yeah, it's estimated that 42% of Americans have obesity. It's now widely recognized as a chronic disease. Will making these drugs covered by health insurance companies help save lives, do you think?
Well, that's the goal, obviously, and the hope is that it will eventually save money. Right now, these drugs are so expensive that when the Congressional Budget Office looked at this in October, they said that the cost would dramatically outweigh the savings, but that over time, as the cost of the drugs come down and that we learn more about being able to prevent some of these other chronic diseases that obesity can contribute to, the savings would likely go up. So the hope is that eventually this would spare people from many other obesity-related diseases.
Well, as you mentioned, it's not a done deal yet. The rule would not be finalized until January and after President Trump takes office. So what obstacles do you think this rule could face, though, moving forward?
Well, there are a lot of them. One is it's very expensive for an administration that says it wants to cut the budget and cut spending. This could add billions of dollars to Medicare. It could also add billions of dollars to Medicaid, which is partially funded by the states. So you could have states that are going to resist this. We have about 13 states now that cover these drugs. It is optional, and some states do, but most states don't. A lot of both states and private employers started covering these drugs, but they are so expensive. The list price on them is over $1,200 a month, that many of them stopped because they just couldn't afford it. So at some point, the cost of these drugs will come down, the prices will come down, and it'll be easier. But right now, were Medicare to start covering them at their existing prices, it would be many billions of dollars.
All right, Julie Rovner, thanks so much for that insight into this.